Hello, I'm talking today to Mother, who is in charge of member care for Capro in Nigeria. Do you want to introduce yourself a little bit to the audience?
My name is Mother Ibarakubwe Are. I am a missionary with Calvary Ministries. Many people know them as Capro. It's a mission agency that have been here since 1975. And we have over 750 missionaries, almost 800 missionaries in about 43 countries. The work of Capro is coordinated in the international office from Lagos. So I coordinate the member care activities for the ministry. I also coordinate the member care events for the whole ministry, working with regional member care facilitators, national member care facilitators, and then peer care groups that we formed to hold discussions and do some training. Yeah.
Wow. Wow. Well, that sounds like a lot of work. Why are you interested in member care? Like, how did that develop? You have any personal experiences there that triggered for you the need for member care?
My husband and I were pioneer missionaries for Capro in East Africa, and it was a very difficult time. We spent more than 13 years in East Africa. About 9 years we spent in a lot of crisis because of the kind of work that we do. Capro works with unreached people groups, like you know, and these are remote areas, and yet these are missionaries working with not much finance, not much care. You know, you may not have the car. You know, it was just very rough. And then the number of staff we have were not many. So going through that was very difficult for me. I decided after that I was going to just go ahead and help missionaries. We had a lot of crisis, like I said, and there wasn't any peer mentoring groups. There wasn't any peer counseling groups. There wasn't any peer member care issues there. And so you see missionaries struggling. We are training new missionaries. We are going to churches, mobilizing people to come in as missionaries, and we are opening fields, church planting in very remote areas. So we saw that lack of what to do with pioneering groups, actually causes a lot of issues for missionaries. We also saw that families were left in a lot of pain. There were no missionary kids, groups that would say, okay, my kids, they will go there and they'll have ideas on what to do with parents who are like crazy, running around, and you don't have enough money to eat. And, so there was nothing caring for the children, it was a lot of pain. And that pain actually pushed me to do my master's in psychology, because I wanted to know how all these spiritual and physical strains affect our mind. And I did that in Nairobi while we were still there as missionaries. And then so when I came back, I saw that non-physical dis-ease can bring a lot of emotional crisis. And when mobile member care came into, there's a group called Mobile Member Care, MMCT, I think. They came into Nairobi. I was there at that time. So I joined that team, and we worked to start the mobile member care in Nairobi. So when I came back to Nigeria, I just told myself member care is one thing I want to really do. I want to give my time to.
What are the top 3 main issues or needs you see your people have in pioneering situations?
Adequate training. Our missionaries, when they're going on pioneering situations, you are the treasurer, you are the admin, you are the trainer, you are the mobilizer, you are everything. So we see that there's a lot of need there in actually preparing, taking time to prepare the pioneers. Another one I see is marriage. We have a lot of young marriages coming up, and they're struggling. Most of Capro missionaries work in field situations, And so you get married and then you go into a field and there's no adequate toilet facilities. That, there's so much strain on new marriages, and we are really thinking of that. We are also, as an organization that have grown, right now we're beginning to see mental issues. It wasn't there like that in the past 10 years or 20 years, but now we see a lot of mental issues coming up. People because of the strain, they come out and they're depressed and they don't know. They come out of the field and they are burnt out and they don't know. They just think there's something wrong with them, but they don't know what it is. Maybe one more. Family health and resilience. We need to have an organized way of dealing with our children so that they don't grow up and they don't want anything to do with missions, and some of them don't want anything to do with God. And it's understandable.
The mental health issues are interesting. Now you study psychology, and there is also the strength of responding to needs in a spiritual way, spiritual warfare, this kind of approach. How do you balance this from your cultural or national point of view?
We are trying to come out of an extreme of everything is a spiritual fight to a balance of, there might be a lot of spiritual issues involved here, but physical strain can actually bring a lot of chemical imbalances in the brain that can lead to some psychological issues that we're dealing with. In Africa, that is a very interesting thing, because for us, everything is spiritual. Maybe a demon is involved. But studying psychology and from the experience as we grow as a ministry, we're finding out that there are some specific fields that when people get in there, because of the strain and the persecution and the struggle, when they come out with a lot of load, no proper debriefing, no proper debriefing, So they come in and just say they are going for a rest. They are burnt out. They can't act. And because they think it's spiritual, they don't want everybody to know they have a spiritual problem or a demonic problem. Nobody wants anybody to know that. So we really get into a state where we are hiding what should be brought up and medications taken and stabilize them, and they go on with life. So that for me is something that is coming out, because we have a lot of missionaries who have worked on fields for 30 years, for 20 years, in very difficult situations, and when they tell you their story, you can just tell them it is not demonic. From what you have gone through, there's a lot of strain and it will affect you mentally. We're trying to bring people to the balance, not that everything is chemical and everything is demonic, but there's an interplay of demonic issues, but there's also a place where there are chemical imbalances.
Now you have so many hundreds of workers out there. Tell me a bit about your programs and how you respond to those needs.
What we are trying to bring in now, for us as an organization, our leaders know that they have shepherd care. You remember that your 7 S's. Yes. You have shepherd care, you have structural care, and all that. Okay. So I'm picking it up from you. All right. So you have savior care. We are very good in savior care because our training institute has a lot to do with spiritual preparation, real spiritual growth issues, and growth in spiritual warfare, growth in interpersonal relationships, and all that. So we are good with that, but we're not good in self-care. You see. We're not good in self-care. And we are beginning to see as an organization that our leaders are taking their role as caregivers. So that when they go to a field, they're not just asking for how is the work doing? They're also asking, how are you doing? How are you doing with your wife? How are you doing with your children? That didn't used to be before. everybody wants to know, how is the work going on? How many souls have you established yourself? And the wife and the children are crying and saying, we rarely see daddy, we don't know where he is, So we are beginning to sense as an organization, and our present directors are saying, hey, every leader take up care, not just because of the work, but because of the workers. So some of the things we want to do is to run trainings for peer member care, run trainings. We are also getting marriage enrichment programs for couples. We also deal with debriefing and intervention in crisis. There are a lot of persecution. Our missionaries were kidnapped. So imagine those missionaries coming out. They need a lot of debriefing, a lot of care. So we are really dealing with how to intervene after crisis or traumatic event. We also run some counseling courses. Apart from the trainings we run from the Global Member Care Network, which you have been very kind enough to help us run through that. But we also run counseling. We expose our missionaries to psychological counseling courses, chaplaincy courses that will give them up more for the kind of challenges that they meet. And then we're also dealing with hospitality. Hospitality, because a lot of missionaries come in, and when they are coming in like a re-entry, they are coming back to the, let's say they are coming back to Nigeria, those of them that are Nigerians, and they don't know where to stay. They don't know where to go to. And they don't have all the money to go and spend in hotels and guest houses, That is becoming a major thing. We are looking for how God will help us to build places, because we are beginning to have attrition, missionary attrition. When they come back and there's nowhere to stay, and it just makes people just resign and then go and do something else.
Wow, that is a lot that you have on your heart there.
Yeah.
Fantastic. Let me ask you a question about our conference in Kenya. In what way would a conference like this be beneficial for you, for Capro, for your organization? That's question number one. And question number two, in what way do you think could other nations benefit from the African experience in member care?
There are very important things we need to start doing now. Because you see, exposure is so important. When you expose somebody working in a remote place to others working in that kind of place, it gives a lot of knowledge, sharing of knowledge, not to talk about how the person comes out of that kind of conference feeling like, oh, now I know why this is. Oh, now I know why. Oh, yeah, I should have. Oh, I like the other way, the way the other guys do this in that other country, So that exposure alone, the exposure alone. So when people come in contact with so much information on what you can do in this area, what you can do with your children, what you can do with newly married, people, you find out that people learn, and that actually helps the work in those places. So I think that is a conference that many people will attend, should attend actually. The second question was on what's our experience. Capro, I would say that has been here since 1975. Just the experience of many years. A lot of people ask, how were you able to keep your focus as a ministry and still get doctors, engineers, lawyers who are working in remote places? They've left their jobs, they've left their careers. How do you still do that? Because we still do that. People still resign from very good paying jobs and join Capro. And the Capro style, you already know us, is that the ministry does not pay salaries. So you raise your fund. And raising fund in Africa is another story altogether anyway. So those years of focused missionary work that Capro has is a lot of, and then of course our failures also bring a lot of knowledge. What we didn't do well is those experiences, I think, would help a lot of new missionary organizations coming up. Our failures, like I said, will also help. If they hear from people who have worked in this ministry for 20 years, what they have passed through and how God has brought them out and what has helped them. So I think Capro actually has a lot of information on how an African can cope with missions, and an African organization can go ahead with missions.
Wow, amazing. Thank you, Mother, for this interview. It's been really enlightening and informative, and I feel your passion for member care, for mission work, and yeah, looking forward seeing you in Kenya. Thank you so much for sharing your heart